record. Okay, so traveler diarrhea, we have different kind of okay, could you please tell me what are the commonest organisms which cause the travel diarrhea? Anybody?
Salmonella, Shigella,
Okay.
E. coli.
E. coli.
E. coli.
E. coli is the most common, okay? The other can be Campylobacter, which is very, very common Southeast Asian countries. So anyway, we will come up to next slide. We'll discuss that. Okay, so traveler diarrhea patient, the same approach almost. Okay, ODPR you will follow, but few things I want to highlight. How bad is it? How many times in a day you went to toilet? Or how many episodes of the diarrhea did you have in the last 24 hours? Okay, this is a little bit change here, but anyway, it's almost the same. So after following this, you need to go. Now you have two choices. Either to put the traveler diarrhea history after this presenting complaint or after the systemic review. Better to put after systemic review. Okay, once you got into the systemic review, do you feel sick? Yes. Any changes in your bowel movement, blood, mucus, anything? After that, you go to the idea, concern, summarize, and then you will go for travel history. Any recent travel in the last 6 months? Where did you travel? Maybe patients have traveled to Thailand or or Malaysia or India or Nepal. A patient traveled to Nepal, likely patient maybe contract with the Giardia, right? Or India is very, very common in these countries, even Pakistan too. So, or hepatitis B, typhoid. So this is very, very common in South Asian country, but Southeast Asian, the most common can be the Campylobacter E. coli. Okay, so place visited, you need to dig the information. You need to ask about travel. Everything relevant. Which place did you visit? Mountains or beach? Duration of visit, when did you travel? Maybe in this scenario they mention he came back yesterday from Malaysia, came back from Thailand, okay, or from India. How long did you stay there? You need to ask him. Accommodation. Where did you stay? My bad. Where did you stay? In hotel or the hostel? Other traveler affected, you need to ask him, any of your friend or colleague has similar symptoms, then you will go for high-risk behavior, which includes do you have any recent contact with someone who has high temperature? Or in the same way you can ask about anybody who has diarrhea. Did you have any procedure or donate, receive blood transfusion during travel? Did you drink or swim in contaminated water? Any recent animal or insect bite, etc.? You will ask here in travel history. Please take a photo of this because we have some station which is totally based on that. So what you have to do, go for ODPR the same way. Relevant system, bring up the GI in this diarrhea history, and then you will go for the travel history before past medical history. Clear? Okay, this is a little modification, just the travel history you need to go in a detail. Okay, sure, this is about that. Then the same thing, drug allergy, you need to go. Okay, the same as we do. Okay, so this is about the travel. Next, now we come up what station or what kind of symptom patient may present to you. So let's focus. The bacteria is the most commonest cause of the travel diarrhea. First is the E. coli. You will have symptoms, acute diarrhea, okay, acute watery diarrhea, and the Campylobacter will be more severe symptoms. Patient will have fever, abdominal pain. Next is Shigella or Salmonella. So these are the most important. Acute watery diarrhea, think about E. coli, but you can also think of a parasite. If the bloody fever in patient travel to Southeast Asian countries like Thailand, Malaysia, think about Campylobacter too. So, first Campylobacter, or if the bloody diarrhea. Okay. Next is the Southeast Asian country. So I already mentioned here. Salmonella is very common in the UK, but paratyphi, not the typhoid. Okay. There are different type of Salmonella species existing in the UK, paratyphi A or B. All if you talk about the South Asian countries like Bangladesh, Pakistan, or India, the common is typhi. So patient will present with high temperature, gradually increase each day, headache, okay, etc. So anyone can tell me what is the treatment for the Campylobacter, guys? A patient come up to you, what the steps you will follow? For example, you suspect Campylobacter. First of all, you will say, yeah, clarithromycin, good, 350 to 500 milligram, okay. BD, 5 to 7 days. Anyway, so any patient come up to you, you discover the patient's symptoms, and then you will say, based on your information, the most likely problem you're having, called diarrhea, is due to your recent travel to any country, for example, Southeast Asia, Malaysia, or like Thailand. So, and I suspect it's due to in a bacteria called Campylobacter. I need to keep your observation or resus room. If it's severe, you need to give him fluid. I will pass to large bore the cannulas in your arm, or I will give you, just simplified, I will give you fluid through your vein, okay? And if he has a fever, you need to say, I will give you paracetamol. And if too much, I will do the examination of your tummy before you go for the fluids, and then you go for investigation. If it's confirmed, then etc. You need to go for stipes and give you printed leaflet. I will prescribe you antibiotic, blah blah. You need to verbalize. This one patient with salmonella, if you need to admit this patient, okay, because it's severe, so need to. So what is the treatment for the typhoid, guys?
Ciprofloxacin.
What? Which one?
Ciprofloxacin. Cipro.
Yeah, in the UK, we give mostly the first line ceftriaxone 2 gram IV, okay, OD, for 7 to 10 days. Or if patient is allergic or anything, so we give azithromycin 1 gram per oral, loading dose in 500 milligram OD for 7 days. Clear? Okay, so this is what we give in the British infectious guideline, is this one. So I just put this one here because you will work in the UK practice, so you should know about that. Okay, so this is about the E. coli. We don't have exact treatment for that, okay, but we need to give the fluid or to support the treatment. In severe cases, maybe we can run an antibiotic too. We need to manage uremic syndrome, which is some patients have this complication, not everyone. The next is we have viral. So rotavirus, you know about in intermediates, very common in children, but norovirus is very common in the adult, but those are traveling in a cruise ship. So might you get a history from the patient cruise ship? If you do so, you just need to give a symptomatic treatment, like control the vomiting, give the fluid if required, and give the safety leaflet to discharge with likely patient will recover within 1 to 2 days. Okay, you cannot give antibiotics viral, so it doesn't work. Parasites, the Giardia is very common in South Asian countries, Nepal, India, Bangladesh, Pakistan. So this is very prevalent in those countries. So if someone travel in there, but it can be Southeast Asia too. So what is the treatment for the Giardia, guys?
Metronidazole.
Metronidazole.
Yes, metronidazole, that's correct. So you will give the patient this one, or 10-dazole 2-gram single dose we give. Okay, these are the medication we give in the UK. The anti-amoeba histolytic, could you please tell me what is the treatment for that? Well, likely patient will
Metronidazole. Give metronidazole
and
ciprofloxacin.
the anti-protozoal drug called dalaxanide, I think is the name. Is the this drug? Yeah, dalaxanide we need to give, also followed by the metronidazole. Clear? So these are all the treatment. See, malaria patient might be present with diarrhea, can be fever, just so it will be very high fever, and can be headache. It doesn't mean, if of course the patient is going to be anemic and had malaria likely cause the headache. All kind of malaria, not only about the cerebral, not only about the plasmodium falciparum, but all kind of usual patient most of time complain about headache. So don't get confused with that. If the headache and you just suddenly jump up to the falciparum, no. All kind of malaria you can have these symptoms. Fatigue, so the children, adult, anorexia, gastrointestinal, such as nausea, abdominal pain, you can find diarrhea, poor feeding in children. So what is the treatment for the malaria, guys?
Artesunate IV for falciparum and artesunate for complex malaria.
Yeah.
The first line is chloroquine. If resistant to chloroquine, we can start with the
we can give artesunate for any patient with the when you suspect cerebral malaria or the investigation reveal falciparum, you have to go for artesunate. If the other, you can go different medication. Even the Vivex, we also give primaquine to eradicate permanently. So quinine, deoxycycline can give, and also the chloroquine. Okay, this is about the, I'm sorry to say, this was traveler, right? See, next we are going to have the patient with bleeding, so history taking first, a little bit focus on that. Odipara will be the same as usual, but few things here, a little bit modification. Intensity, you will add some more questions. How often do you vomit, blood in stool, or how often do you have blood in stool? What is the color, bright red or dark red? Any clouds? How many pads have you changed? For example, vaginal bleeding, in this case, you will ask about how many pads have you changed. What quantity, how much, 1 teaspoon cup, just the, you just say like that, if we measure the quantity, could you please tell me how it would be, like 1 teaspoon or a cup? Okay, so this way you can elaborate more. Progression, is it getting better or worse with time? Is there anything make it worse? Relieving the same everything, just the difference is here intensity. You need to ask about the in detail. Idea, concern, GI, you need to go for it. Systemic review, summarize. But if it is a vaginal bleeding, then you have to aid the menstruation history. At what age you have had your first menstrual period or first period, or when did you have the first period? Just need to ask this question. When was your last menstrual period? So this is likely to ask with the vaginal bleeding in the patient is postmenopausal, which is very, very common station, came in even in previous diet for some candidate. So this is very common station you will have it. And you need to be master of this, because this station was something special, I would say, because this station, you cannot suspect what could be the cause. There are so many differential, and you need to explain the differential in this station. This is the station where you need to explain the differential, and you also need to, if you have time, tell the treatment as well. So this is a very important station, because you cannot suspect. First, you are not gynecologist, you're an ED physician. If patient present to you, you need to think broadly. Okay, so this is about history taking. The rest of things are the same all the way. You need to go, just you need to add menstruation history if the patient has vaginal bleeding, not in other. You need to elaborate more symptoms like bleeding, about bleeding intensity or color, etc. How much quantity you need to ask her or him. The next slide we have, so these are the this slide about what could cause the bleeding. So in the curriculum, we have CC1 code, CAP16 or HIP16. These are the MRCEM curriculum code for that. This is the same in intermediate too. Okay, so hematoma says, so warm dark ground coffee appearance, so patient will complain like it can be melanin, but this is very, very common in lower GI bleeds. Less likely in upper GI, but you cannot say never, can be, okay? So I'm talking about this. This is also, so there are two types of bleeding, varicose or the non-varicose bleeding. So what is the treatment for the varicose bleeding, guys? What you will do in based on your information, you suspect, okay, blah, blah, blah. Now what you will do?
Occuroids.
You will go from beginning. You need to admit this patient, right? You need to vitals check, all everything. You need to give fluids. You do investigate. You need recover blood. You need to transfer blood transfusion, etc. Then you will come up to the drugs, terlipressine or somatostatin, and the antibiotics for this patient, okay? And if it is the esophageal varicose, you need to go for endoscopy, bent ligate. If it's the gastric, then you will go for balloon tamponade. You just need to verbalize, but you don't have to do, because this will be done by gastroenterologist, right? So this all step, but you need to remember your treatment. What you have to do, give the fluids, require transfusion, depends on the investigation or on the patient appearance. If he's told you a lot of bleeding, of course, you have to go for blood transfusion. Okay, so this is about varicose. How about non-varicose bleeding? What are the most common cause?
Anticoagulants.
Ulcer disease, peptic ulcer disease.
Peptic ulcer disease, the drugs with the blood thinning medication, these all can be. So what step you will take? Will you take? Excuse me.
High dose of PPI, IV fluid.
Follow the guidelines. Follow the guideline, guys, because you work in the UK, you will a lot struggle in the UK if you don't follow the guideline. Endoscopy, okay, first line. Need to go for endoscopy to check the ulcers, okay, and also treat with the clip with or without adrenaline. I will simplify it, okay. So what you will say, you need to give the fluid everything, then we will refer you to gastroenterologist. He will pass a telescope with camera from your mouth towards your stomach to check the ulcer. Okay. If it is large, if it requires treatment, we will give you some clips and some drugs to stop bleeding. Right? You need to explain, because these all bleeding patient investigation, of course, you will go for full blood count, etc., H. pylori, etc., everything. But if bleeding, of course, large quantity, you need to stop the bleeding anyway. You cannot ignore it. So this is what you have to do. You need to explain him. And the treatment, endoscopy, you will use the clip or with or without adrenaline or thrombin or fibrin, etc. And then you will, if also in investigation, if you find H. pylori, you will treat with the antibiotic and PPI. PPI you use after endoscopy, not before. Clear?
Yes.
Yeah,
Yeah.
so this is the guideline. I think you, maybe if you remember intermediate, the first line in is endoscopy. Clear? So you need to follow PPI then.
Shall I use any score here?
Endoscopy, doctor, after resuscitation.
Yes,
After I
you
resuscitate him, then after that I will call for
Yeah,
urgent endoscopy.
yes, you should do it. If the patient is unstable, you will do first resuscitate and do in 24 hours. This is a guideline. If it is stable, go for endoscopy. And the
Okay.
most important, we use a kind of a score, if you remember,
Which
Glasgow Blatchford score. So you need to tell about, if the score of patient is 0, you will tell her that I will discharge you with outpatient endoscopic treatment. If it is 6 or more, I will admit you, okay, or I will keep you here, and involve the gastroenterologist, do the telescope camera scan, pass the telescope with camera to check out inside. Okay, you just need to tell her the management plan, but your job, you need to tell her what you know, okay? What gastroenterologist will do. Okay, so you need to tell, but your job, very important, is the resuscitation. And the next, you need to explain what step will be taken. That's your job, to tell the patient, to convince, make her ready. And you need to use the Glasgow Blatchford score too. And just need to verbalize, if it's 0, I will discharge you. If it's more than that, so there are some important the parameters we see in this score. For example, urea, hemoglobin, systolic blood pressure, other melena, syncope, hepatic or liver failures, renal failure. So these are the important points of Glasgow Blatchford score. Clear? We'll come up, we have some station, we will practice. Okay, so it's upper GI bleeding. Next is we have, make sure you follow the guideline, okay? Don't jump up your own prediction, because it doesn't make sense. If you don't know the guideline, you will a lot struggle in the UK, even you or junior doctor or any senior, but you will not understand the system, very complicated. You must be understand. Keep all the time nice guideline up to date, okay? So these are some of them nice guidelines, some other association guideline, which I will tell you in HIV. Okay, so lower GI bleeding, the hemorrhoid can be, okay? Patient will be bright red bleeding, painless, covering the stool, history, constipation. He will give you constipation history, likely, and we'll say bright red blood only in toilet paper. Okay, so this is another cause. About the anal fissure, these patients usually come up with the pain, not with the lower GI bleeding in this station. So divertical disease, usually patient is 65, bleeding is still dark red color, etc. So these all are the cause of the lower GI bleeding. So what is the steps except the hemorrhoid? Could you please tell me what would be your step except hemorrhoids? Other all step, what you will take? What does the guideline say to us? After resuscitation, you give fluids, you give everything. Now patient is stable, or what step you will take it?
We'll do
have to do
endoscopy
also
or
Colonoscopy.
Yes, that's correct. Colonoscopy, you go for.
Colonoscopy,
And
Yes.
most often, all of the patients which came of lower GI bleeding, they have to go with the colonoscopy, etc. Hemorrhoid, maybe you go anoscopy, okay, not colonoscopy. Clear? But however, both are the camera scan. So all lower GI bleeding, you would go for that. You need to explain her This is the protocol, but your job, important resuscitation, you need to explain. If you think it's divertical, you need to mention it could be diverticular. If you think it's inflammatory bowel disease, patient has you see wet loss, fever, systemic upset, etc. Another thing is lower GI bleeding is medication. Okay, medication, blood thinning, warfarin. These drugs also cause the lower GI bleeding. Not only this condition, but the medication as well. So keep in your mind too. I didn't write it here, but you should know about it. Okay, so this is about the lower GI bleeding. Clear? Colonoscopy, you will go for it, okay? And then you go for the colonoscopy can be treatment, can be for diagnosis, can be therapeutic purpose for both. Clear? So you need to use the same way like endoscopy. You will use epinephrine or with or without clips to stop the bleeding. Fibrin or thrombin, you will use it to stop the bleeding. Okay? Clear? Okay, so
Yes.
next
Yes, sir.
we have next is vaginal bleeding. This is very, very important because this station came up a few times and mostly the candidates are struggling to understand. So postmenopausal bleeding, the several causes can be atrophic vaginitis or the endometrial or the atrophy, cervical or polyps in the endometrial hyperplasia. So what you will say if you suspect this one, you need to tell her, I need to rule out other differential, or you suspect, you can say it can be. Based on your information, the most likely problem can be this, or there are several problems of the vaginal bleeding. Those are, you need to mention, those are atrophic vaginitis. In this, you need to mention that it can be like, this is condition in which there is an inflammation in your vagina or the worm. So you just need to mention like that. This can be due to your low level of the estrogen. So you need to mention her due to you have gone through to menopausal. So that's why it's decreased, which is less likely in young patient never. And another, so what is the treatment for atrophic vaginitis, guys? If you need to, you told her the diagnosis, it can be this or the differential. So what is the treatment for that?
Estrogen cream.
Topical estrogen.
therapy.
Yes, yes. So you will say her that if it's confirmed that, then I will give you a cream called estrogen cream, which you need to apply, and a nurse will guide you how to apply. Okay. Another, we give the device called Passray. You will say device which you need to insert, and it will treat your infection. Clear? So the Passray or the estrogen cream. So these two both are the option for this endometrial atrophy or the atrophic vaginitis. Clear? The next is cervical or rim polyps. So you will say her that if it's confirmed cervical or rim polyps, so fortunately it's non-cancerous, so you don't have to, because this patient will come up to you in the station, will say, I'm worried maybe I have a cancer, because all postmenopausal women in developed countries, or even I don't know about whatever in your country, but what patients usually encounter, they always worry about maybe I have a cancer, maybe I have a cancer. Okay, she maybe interrupt you, say you again and again. Okay, so maybe, so you need to say, unfortunately, or fortunately, it's non-cancer, it's benign condition. So what is the treatment for polyps, guys?
Conservative.
Cautery.
It's record removal, right? You need to refer to gynecologist to remove this, and depends on how are they. Okay, so you can say like the base if it's confirmed that I will this record the removal, so I will refer you to gynecologist or obs and gyne department for treatment and assessment. Clear? Another is endometrial hyper.
How I can differentiate if it's a polyp or not?
No, you don't need to tell her.
Uh,
You will not even suspect the diagnosis. Okay, you will tell her there are many causes of the vaginal bleeding. Okay, you will tell her based on your information, which are there are many the cause of this condition is you're having postmenopausal bleeding. This can be atrophic, this can be this. So in atrophic, then you explain what is atrophic vagina. It means is the inflammation in your vagina can be warm. So the treatment, the good news is that it's easy to treat. Like you will say, oh, we use Pasray, I will recommend you, or I will prescribe you estrogen cream, and I will tell you how to apply, or I will ask a nurse to guide you about that. And another condition can be, then you add further condition. Another condition in your case can be cervical womb polyps, because in the exam, they will not say like you just diagnose and give the management. No, they will say you tell the differential. Okay, so I have the station, you will see by yourself. I made it the scenario for you, and almost exactly same scenario you maybe encounter in the exam. So in that scenario, it's mentioned that you need to tell the differential. So in differential, they also put the score, not only in the management plan. So in differential, you will add the condition and management plan for that. Okay. So in this station, no anything is confirmed. You even don't need to, you just need to tell what could be the condition. You need to explain the condition. Next is our endometrial hyperplasia. So a thickened womb lining, this can be caused by hormone replacement therapy. If she is on, when you ask about the, are you on hormone replacement therapy, because all postmenopausal you need to confirm, or are you taking any other medication? So she will tell you yes or no. So if do so it can be the cause of endometrial hyperplasia. Okay. Or the patient being overweight. So in all this situation, you still need to refer this patient to obs and gyne. Ovarian womb cancer needs a hysterectomy, which is very less common. The guideline states 1 in 10 women usually have the cancer, can be, but 9 people from 10 usually do not have. So that means it's less common. Okay, so cancer is very less common, but can have. Okay, so this is about the vaginal bleeding. I think I forget. Hematuria is the next one. Okay, so next we have about it's also relevant to bleeding, the hematuria, blood in urine. We also already discussed HSP, the nephrotic syndrome, which can be glomerulonephritis. Actually, glomerulonephritis extends to nephrotic syndrome. So patient can present with you with these features, Coca-Cola urine or etc. And you need to manage, you will give control the blood pressure with SE inhibitor, the furosemide, parenteral leaflet, like to control the diet, low sodium diet, etc., and follow up with the nephrologist. Blood and renal cell carcinoma, you need to refer to oncologist, okay? But you need to resuscitate this patient in case patient lost a lot of blood, okay? So this is your job. Kidney stone, we already discussed, usually patient present to pain, but it can come up with the blood in urine, so you know how to manage, give the NSAID, non-controlled CT, okay, and then you need to explain the treatment, shock wavelets, strips, etc. And for that you need to refer to urologist, but you need to give your management plan first, okay? Lower UTI can be come up to you, dysuria, frequency, urgency. So can be patient present with hematuria. So what is the treatment for lower UTI, guys? We haven't discussed about it. In adult, male.
Nitrofuratoid.
Yes,
Trimethoprim or methylphenidate.
yeah, trimethoprim or the nitrofuratoid first line, okay. Then you have to change the second line if not suitable. Okay, next is we have to go for, we have, I think, sexual transmitted disease. Okay, so the next, our history taking a little bit modification in sexual transmitted disease. So you will go the same way, Adipara? Systemic review. And then you will take the consent. Why I aid the consent here, guys? Could you please tell me why I aid consent here, but not in most of the station? What do you
Because
think?
there is private questions.
Yes, this is very important because you are going for the private question. So you need to take the consent, and more likely the patient will not tell you. Another important point I aid in sexual history. Another, look, empathy, I'm really sorry to hear that. Are you comfortable first? Because sometimes they don't tell you anything. They are very shy. They don't discuss the private. I have one station. You will see it. Another, this, for example, is a Simon name. So you need to verbalize. We are in a private room. Anything you will tell me will be kept confidential. How does this sound to you? Because you need to make him comfortable. You need to encourage him to speak up, okay? So this is very important in sexual history when you are especially taking, okay? So you need to aid these important points that patients should feel comfortable, then you go for the next open question. Clear, guys? One is this point I modified here, and another I modified here in the sexual history. So the consent you need to take because these are very private things. You need to take consent and then go for any other partner apart from your regular partner. Was the other person involved in sexual contact, male or female, or the men or women? Just make more simple. Where were they from? Because sub-Saharan Africa, it's not good to say, but I don't know what is the guideline push up it. The people from sub-Saharan Africa, maybe they are high risk source of HIV. So need to ask this question, okay? Any other partner has or had any sexual transmitted disease or medical problem? Any of your partners, sorry. Any of your partner inject recreational drugs? You need to confirm. The preventive measure, you need to, were the condom used? Was the sexual and consensual? Was it a sex worker? Sex worker means exchange for money, right? Likely the sex worker, you always the exchange for money and it's not free. So this or there's some benefits or expectations, so that's why. Then you go for idea and consent. I put it last in the end here because you take all thing and then you confirm and then you summarize. Like Mr. Simon, you said that you have blah blah, and also you confirm that you had the last sexual act with your partner. She's from there, and you said that she has this disease. Is that correct? Okay. Then you go for past medical history, drug allergy, family history, etc. You have to go for it. The same. So for these all stations, you need to be very, very fluent. And believe me, if you are fluent, you will have a lot of time. You will finish on time, means in 8 minutes. Not less than 8 minutes, not more than 8 minutes, but you will finish around about 8 minutes. So that's why the RCAM especially designed the time before 6 minutes, and now they made it 8 minutes inside in the station. Don't worry about that. It's not very long station. You will do it. Just a problem you need to practice again. Okay, so let's focus on the condition. So these are very important condition, which is sexual transmitted disease. The most common chlamydia. So chlamydia, you see increased vaginal discharge, postcoital or intermenstrual bleeding for the women. The problem during pain and during sexual activity, pelvic pain, tenderness, etc. Inflamed or febrile cervix and the bleeding, which may bleed or on contact. So suspect chlamydia in the main dysuria, ureter discharge, ureter discus. So what I want to say, when you take a sexual history, you are not confirmed what could be the chlamydia, can be gonorrhea, right? So that's why we go for the two things. Either this is a high risk or low risk. Okay, we will come up to the guideline in which is given by the British HIV Association. So the high risk or low risk, usually we focus more on the HIV, also the other, but likely to focus on the HIV. So any main sex with main, they are high risk. We have the next slide I will discuss. So let's move on. So chlamydia, these are the features. If you found out or if you suspect, then you have to go treatment. So what is the treatment for chlamydia, guys?
Macrolides, Cipromycin.
Okay.
Macrolide.
Okay, just give me 1 second. I want to come back to the vaginal bleeding because I want to clear some points here because I don't want you may have the problem later on. So guys, what you will do if you suspect vaginal bleeding, you said, okay, according to your data, these problems. So what you will do in investigation, guys? What investigation you will take it? Because I want to make it simple for you. Then move to
Vaginal swab.
I've done it, yes.
Vaginal swab.
UBT to confirm.
You first of all, you will involve the chaperone, right? You will say, I will do the examination of your vagina. Okay. The wall in front of chaperone. Okay, chaperone will be here. Well, involve the chaperone, under chaperone. Okay. I will pass a small plastic device called speculum. Okay. Pass through your vagina and hold it open to check inside in your cervix or the womb. Okay, uterus. So you need to simplify this way. Another investigation, one more investigation, apart from that, I will do a scan. A small device will be placed in your vagina, transvaginal. I'm talking about transvaginal scan, okay? Scan for, I will insert a small device in your vagina to scan for any problem, okay, in your vagina or around there. Another, you will say, we use hysteroscopy, right? So this you must need to verbalize, okay? So another, we have like a telescope, like camera. I will pass through your vagina towards the cervix and into your womb to look for any problem there. In medical term, we call hysteroscopy. So I just want to tell you what investigation you need to do. Okay, clear? So when you are going to have this station, you need to verbalize these things. Okay, let's come up back to the infection. Okay, so chlamydia, guys. Someone told me macrolide. Someone told me I don't know what more. So could you please tell me?
Tetracycline.
Yeah, the first line is doxycycline is 100 mg for 7 days. If it's contraindicated, then you need to give azithromycin 1 gram single dose. And what you will do then? What's the next step?
Swab culture.
it's not your
Gum
job
clinic.
it's not your
Gum
job
clinic.
to do swab culture. You need to refer this patient to gum clinic.
Gum clinic.
Gum clinic,
Okay.
yeah.
And to screen the partner.
Contact tracing, screening, all will be done by the gum clinic. Clear?
Yes.
Okay, so the first line doxycycline, then you need to go for the azithromycin 1 gram if it's contraindicated. Okay, single dose. Gonorrhea. Anybody tell me gonorrhea? What is the treatment for gonorrhea infection?
Ceftriaxone 100 GIM plus azithromycin 1 gram.
Yeah, that's correct. So you will give the patient like the ceftriaxone or the azithromycin. So what could be other things you will do? Advice for the patient. What would be your advice? Do not perform sex until you get well for 7 days, right? Without any barrier, right? Must use condom. If you suspect it's a high risk of sexual transmitted disease, other like HIV, hepatitis B, you will also advise the patient, do not donate the blood, okay, or receive blood. Number 2, you do not perform any sexual activity, okay, without any barrier. If you do so, use at least a condom. Clear?
And also
And refer to
treated other partner, doctor?
Yes, this will be done. Treat other partner will be done by the gum clinic.
Okay.
Counter tracing leaflet will be given that he need to inform his partner, and then she or he need treatment. Okay, syphilis. So what could be the treatment for that? First of all, it's very. I don't think so. You will have a station, but can be possible. So what is the treatment for that, guys?
Acyclovir.
Injection.
No, that is herpes, not for that.
This is syphilis. So the common is the penicillin G. We say benzathine or Precaine. Clear? So this is the treatment, but however, you need it's less likely. It's need to be divided in primary, tertiary, etc. Overall, you need to take the infectious disease help also, the infectious specialist for this treatment, and you need to admit this patient if he present to you these symptoms. Okay, so next is we have genital herpes simplex. This is HSV2 usually. So what is the treatment? Okay, first need to a little bit focus on the lesion. You will have ulcers on external genitalia, perineum, or the perianal region. Can be itchy, can be possible tingling sensation over there, and another can be with the dysuria, urethral discharge. You can have the other symptoms, common cold like fever, headache, etc. So what's the treatment?
Acyclovir.
Yes, acyclovir is or 400 milligram BD for 7 days, I guess. So this is the treatment for that. So let's come up to the post-exposure prophylaxis. All patients which come, you suspect sexual transmitted disease and it's a high risk, you must verbalize the post-exposure prophylaxis. So it's not only likely the patient will have the gonorrhea or the chlamydia, but can possibly the HIV too. So let's talk about the HIV, high risk source of HIV. Men who have sex with men, female sex contacts or male sex men, people reporting current or pre-injecting drugs, so all the drugs which are recreational drug injector can be high risk, or the high risk, sex workers, trans women, people from a country as seroprevalence greater than 1% is originating from sub-Saharan Africa, people reporting sexual contact with anyone from a country where high diagnosed seroprevalence. For example, hepatitis B, C, these world-borne diseases are very, very common in the South Asian countries if we compare with the rest. So most likely, I would say developing countries. So you need to be also go for that for HB vaccination. not only about HIV, I'm talking about Hep B, C as well. Individual known to have had a mother living, etc. So multiple partner can be considered as a high risk too. Okay, so it's not only about the this one, the HIV. Next is the post-exposure prophylaxis. So when to give, ideally within 2 hours, preferably within 24 hours of exposure. And post-exposure is not recommended if exposure was more than 72 hours. So this is about the post-exposure prophylaxis. Any patient which come up and you suspect is a high risk, so you need to check it whether this patient presented to you before 72 hours or the after. If after, you will not give the post-exposure prophylaxis to this patient, okay? But you will give the azithromycin or the ceftriaxone, and then you will refer this patient to the gum clinic. And along with the advice you do not donate the blood, you don't do any sexual activity without a barrier. So this advice will be given to this patient. And if the needle stick injury, the same protocol you will follow, okay? So these are the things. And other things, what you will say, the gum clinic do what, guys? Gum clinic do what? What is the job of the gum clinic, guys? Anyone can tell me.
Contact tracing.
Okay, contact tracing and?
Gum clinic will screen the patient from.
Yes, in screening the patient, do the hepatitis B, hepatitis C, or any other, if the patient is having some kind of
Hello? No voice.
Okay, I'm sorry. So I had a call right now, so I just close it for temporary. Okay, so what I want to say, the gum clinic will do the screening, okay? Screening like the hepatitis B, C, urethral swab, HIV, everything viral load. If the patient is HIV positive, you need to go, the gum clinic will do the viral load. Okay, clear? So this is about the this post-exposure prophylaxis. So what you will say
regarding the viral load, is it, if it is more than 200, then it is supposed to be patient is high risk, and then in that case we will give PEP.
No, it's not relevant to the viral load. It's all relevant to the high risk source, the high risk patient. Any patient present to you with high risk source, if for example the patient said, I did last time, the previous 2 station, which I remember, the guys give exam, they said the main come up and he said I sex, the main was a man, he said I sex with the main. He said I have a boyfriend. He's a, I think so, maybe he's a gay, but he said I sex with main, and he's, when you ask about the penetration, he said the anal. So he said that, so this is a high risk, okay, regardless of the HIV positive or not, but this is high risk for the HIV. So you need to go for a post-exposure prophylaxis for this patient. Okay, so sometimes the patient usually maybe ask you the question, what mean by, doctor, what's mean by post-exposure prophylaxis? So could you please tell me what mean by? So you will say how these are the medication we use to avoid from HIV, or in case if your contract can be treated with that. So can be, maybe if he ask you the drug, so you need to add it here, like tenofovir or the Praxil. So these all are the drugs we use for the post-exposure prophylaxis. Clear?
Yes. Okay.
So what you will say, if high risk, you say based on your information, you are at high risk of the sexual transmitted disease, Okay. And the good news, or you can say if he came up on time, so therefore I'm going to keep you here, observation, do examination of your genitalia, okay? And then I will check it, and or I will do, then I will give you the medication, the called post-exposure prophylaxis, to help you to avoid to contract with the HIV disease. I will also give you, if you all think it can be chlamydia, because if the patient says my first new partner, I'm going to have sex, so chlamydia likely, I will give you also the medication antibiotic, this is balabala, and I will refer you to the gum clinic for where? Screening the gum clinic. In the gum clinic, you will be screened for hepatitis B, HIV, all you need to mention. And apart from that, your partner, which is, he need to be treated, and the contract tracing, that means. So, and also advise you, please, I will give you a printed leaflet. The advice will be written in there. It would be like, you don't have to donate or receive the blood, okay? If you are going to do any sex, and you must use the barrier, okay, condom. So you need to mention that. So there's all things you need to mention. But if the patient come up with the less than 72 hours, so you will mention that you are not required post-exposure prophylaxis. Unfortunately, there is a specific time for that. 72 hours should be given. But I'm going to give you antibiotics, which are for the common infection, called azithromycin. We can use on both. So you can say, I give you azithromycin 1 gram. Okay. And then I'm going to refer you to.
Doctor, 1 point, please.
Yes.
I will start the medication prophylaxis, then after that I will refer for screening.
You need.
Prophylaxis. I will start it first, then after that I will refer him to the gum clinic for screening.
Yes. Do you know why? What's the reason? The reason to that, this is time specific. Okay. Time is 72 hours. This is the most important. Otherwise, we can go after what else. But if you think the man is sex with a man and there is high risk, go for post-exposure prophylaxis, because this is given by guideline by the HIV Association of the Britain. So you need to follow it, go for the post-exposure prophylaxis and refer to gum clinic. Because if he's really contracted, then you lost a chance, right? That's why the time is specific. You need to refer.
Yeah, time.
Give the post. Yeah, time frame. Okay.
Thank
so
you.
this is about. Yeah. Any question? Because we will go for the role play soon. Yeah, we are in the end. Okay. So what's your question? Yes.
The question is if the patient is female. If the patient is female and it is in the reproductive age, and someone with a sexually transmitted disease do a sexual act, so we have also to consider contraceptive if the patient comes within 72 hours.
Yes, if the female, you must consider contraception. I forget, sorry, good, very good, excellent, you at this point, yeah. Contraception, you need to add it if the female, okay? Good, excellent. What's your name?
Dr. Rafiullah.
Dr.
Rafiullah.
Dr. Rafiul. Okay, so excellent. So you need to aid the contraception too if the female. Great. There was someone asking me a question, please.
Yes, sorry, doctor. If I can see a slide again of syphilis and herpes simplex virus.
You are talking about syphilis? Okay, I'm here. Is it okay? Is it okay? I don't know what's the name of this.
Yes,
Thank you, doctor. Thank you.
Okay, you're welcome. So now we are coming back to the role play. So I have a station. So please be ready. note the important points where you need to more focus. You need to cover. Sometimes if you forget to cover entire systemic review, no problem, but you need to cover the relevant. Must cover relevant. Clear, guys? So we are coming back to you after a few minutes, around 10 minutes break, okay?
Okay, good.
Okay, so after 10 minutes, we come up back to the role play. So I give you 10 minutes that you need to think. I tell you the station, what could be, I show you that you, okay, one time I show you that you should get ready for, okay, this is the patient, he has a personal problem. This station can come up with different ways, either you burning maturation, and this is totally relevant to the sexual history from the word you can guess it. Okay, this is time, it will work hopefully. And next station we have urethral discharge, okay? So this is the same sexual. I just added 2 different slides because I want to make sure you understand the station can be present to you different ways, okay? There are many ways to explain the station, so that's why I put it in different slides. And now that we have the burning maturation, next we have the dark stool, can be upper GI, can be lower GI. Another vomit blood. Another we have the lady noted blood in her stool this morning. Another station we are going to have the blood in urine. We have vaginal bleeding. We have the diarrhea. Thailand travel. This patient traveled to Thailand. Another we are going to return from Malaysia. So this is the end. So we have good stations.
And
so
all those stations appear in the previous exam? All those?
They all already came up in the exams. Not in previous exam, in last all the examination. Usually these all stations come up with the same way. Why I'm stressing out the management plane? Because the outcome is not going to change the station. Okay, your curriculum is the same like intermediate, but the problem is they want to test you how you manage the patient. Not like the way you use the, in your country, okay, I give ciprofloxacin and destroy the patient. If you do so that means you are not up to date with the guidelines. So mostly my focus on everything is the important is the management plan. You must be very, very familiar with that because half of the score come up from there. Approach you can get, listen to me or read any books or can get from anywhere. But the management plan is all in your hand, up to date with the guideline. This is very, very important. Another is practice. If you practice here around 40 or 30 plus candidates or the live here, so if you practice, that means you kill your fear and you're staying strong and you cannot be shy. That's why this platform is given to practice. See you guys in 10 minutes, okay? And tell me that you can hear the music or not, because I'm going to open the music and let me know if you can hear or not, okay? Just confirm me that you are hearing the music or sorry, first of all.
So we will be back in 10 minutes.
Yes, you will come back in 10 minutes. We will continue with the role play. Okay, so let me know if your music is on. If not, let me know.
We can't hear it.
Now?
Yes.
Now,
yes.
Yes? Okay, so see you in
Yes.
Okay, it's a good music. It will, when I was preparing, unfortunately, it's very long story. I was preparing for the USMLE and I will always get this music before I go for it. So thanks so I just added for you guys to listen and what else.
Thank you.
See you in 10 minutes, guys.
Okay.
Okay, Doctor, can you please pronounce your name, Dr. Bosch?
Medina.
Medina. Okay.
Medina.
Okay. Medina. Okay. So, okay. Let's go.
Yeah. Okay. Shall I start? Okay.
Yeah.
So, hello, I am Dr. Medina. I am ED registrar. May I confirm your name and age, please?
Yeah, I am Jake. I'm 25.
Nice to meet you, Jake. How can I help you today?
Yeah, doctor, I don't know how to say, but I have some problem in my penile area, I would say.
Okay. Sorry for hearing that. Okay, are you comfortable, Mr. Jake?
I'm okay.
Okay, so we are in private room. Okay, anything you will tell, it will be kept in confidential between us.
Okay.
How does sound to you?
Thank you.
Okay, Mr. Jake, just I will call the nurse. She will be at the chaperone, okay? And please, can you tell me a little more about your symptoms or your problem?
Yes, my wife is one to home, so I went to the bar last week, and in the bar I met a girl, and we came up home, and I had unprotected sex with her twice. So since then, I feel uncomfortable in my genital area.
Okay, so is it start gradually or suddenly?
I think suddenly, yeah.
Okay, so when did exactly it started?
Yesterday I had it, and today I came here.
Okay, sorry for hearing that. Okay, how bad is it, Mr. Jake? Any chance you can score it from 1 to 10?
Oh yeah, it can be 5. Can say uncomfortable like 5 scale, yeah.
Okay, sorry for hearing that. Okay, so Mr. Jake, is it getting better or worse with time?
No clue, doctor.
Okay, okay, so not anything it making worse you need notice or making better? You are not noticing?
No clue.
Okay, so any other associated symptoms with this?
Yeah, if it's something come from my area. In this area, I found some fishy things, like, yeah.
Okay, you mean some discharge?
Yeah.
Okay, do you notice the color of this discharge?
It's just yellow, maybe, would say.
Sorry?
Yellow?
Okay, yellow, sorry. Okay, so do you have any other skin rashes?
No, I have.
Okay, anything?
Yeah.
Yeah. Continue, sorry. You have what?
No rash.
Okay, so any temperature?
No.
Okay, any heart racing?
No.
Sorry, any shortness of breath?
No.
Any headache?
No.
Okay, so I need also to ask you some important question, Mr. Jake, okay? Already we have a chaperone with us. Is it okay?
Okay.
Okay, any other partner from your regular partner?
No, just with this girl yesterday. Sorry,
Okay.
1 week ago. 1 week ago. Yeah.
Okay, so she's a female.
No, yeah. I
Okay.
took from
Okay,
club.
Okay. So you know where she's from?
Yeah, she's from here, UK.
UK. Okay. Do you know any history for her? She have any sexual transmitted disease or no?
No idea, doctor.
Okay. So the sex, it was vaginally or?
Yeah, all kind of.
Okay. So it was protective or no?
Not protected.
Okay. Sorry. Okay. So it was consensual?
No, it's I cannot say because when she left, she asked me money and I pay her.
Mm-hmm. Okay. Okay. So any injection, I mean any recreational drug, you use it?
No.
Okay. So do you have any past medical history?
No.
Okay. Do you have any surgical history?
No.
Are you taking any regular medication?
No.
Are you allergic from any medicine?
No.
Okay. Do you smoke?
Sometimes.
Okay. Or drinking alcohol?
No.
Okay. So you have any family history, family disease running in your family?
No.
Okay, sorry for this question. Do you have any history of sexual transmitted disease before?
No.
Okay, so just let me to sum up for you, Mr. Jake. Okay, you told me that you did the sex with unknown female that you found her in the bar, and it was unprotective. After that, you feel uncomfortable, and you have penile discharge. It was yellowish in the color. Am I right?
Yeah.
Okay. So according to your data I collected from you, most probably you get some sexual transmitted disease. Okay. Most probably maybe it is chlamydia. Okay. So I will give you doxycycline, this one doxycycline medication. Medication called doxycycline, and I will refer you of gum clinic, and be sure that no sex with your partner without protection, and don't donate blood, and the gum clinic, they will do all screening for you. Is it making sound for you?
Okay. Thanks. Good.
Okay. Thank you. And any question?
No.
Do you understand my plan?
No.
No.
Yeah. Thank you very much, Dr. Medina. You
Okay,
did very well. You did a lot better than previously. So the things you took the consent?
Yes.
You took the consent. Okay. Summarize you did. So you need to say that based on your information, you are at the high risk of sexually transmitted disease. Okay. But in your case, because this main said like his wife is gone, so he had a new partner. Yes, he went to the bar and he picked up the girl and take home. What else? So it's a new partner for her. So like chlamydia, but can be other problem, can be other sexual transmission. So you should say him that you are. We do give the post-exposure prophylaxis, but in your case, it's not because it's already time frame, so which is already greater than 72 hours. As you said, you have a sex 1 week ago, right? So you need to mention post-exposure prophylaxis. Give or not is no problem, but you need to mention. Okay.
Yeah.
And then you refer to gum clinic. They will do if you have time, because here I put the 7 minutes, but you will have 8 minutes. And till that you will be very fast, so you will have still a lot of time. So you will say that refer you to gum clinic. They will do some test. They will do urethral swab. They will do other screening of like hepatitis B, C. If it's confirmed, they will also give you hepatitis B vaccination. So you need to mention that. Clear?
Okay.
Okay.
Yeah, clear. Thank you so much.
You're welcome. So just need to follow approach and make your management. Yeah, this management plan is good, but you can still make it perfect. Okay, so next one is I don't know who is there, but anyway, Let's move to, is it recording? Yeah. The next
Yes,
one.
I can.
Okay, so go ahead. Oh, this is the same urethral discharge, but the station, okay. Or you want to do burning micturition, okay? So it's the same station, already did it, but if we will see if someone has time.
Hello, I'm Dr. Ryan, emergency registrar. Can I know your name and age, please?
Yeah, Jerry, I'm 20 years old.
Nice to meet you, Jerry. May I know how can I help you today?
Yeah, doctor, I feel like when I do go toilet, I feel like something burn.
Okay. Are you comfortable now?
I'm okay.
Okay. I would like to take more information regarding this, Jerry. Will that be okay?
Okay.
Okay. Can you tell me more about this?
Yeah, doctor, it started, I think 2 days ago. I had a unprotected sex with my my one of friend. Okay.
Okay. May I know if it started suddenly or gradually?
Suddenly.
Okay. And do you think it's getting worse or better, or is it the same?
It's the same.
Okay, you mentioned 2 days ago, correct?
Yeah.
Okay, did you notice anything that makes it worse or better?
No.
Okay, and do you have any other symptoms with it?
No.
Okay. I just need to ask you some few sensitive questions. We'll take you to private room, and everything will stay confidential between you and me. Would that be okay?
Okay.
Okay, also ask the nurse to attend to the chaperone.
Okay.
Okay, may I ask you if you mentioned you had sex 2 days ago with your friend.
Yeah.
Can I know if your friend male or female?
Male.
Okay, and can I know is he your regular partner, or do you have other partners?
No, it's regular.
Okay, and may I know the type of sex? Was it anal, oral, or mixed?
Anal.
Okay, and by any chance may I know if it was protected? You use condom?
No, not protect.
Okay.
Stir up.
Okay. May I know it was consensual?
Yeah.
Okay. And can I ask you a few questions about your partner? Do you know if he had any history of sexual transmitted disease?
No, clue, doctor.
Okay. And may I know if, where is he from?
He is from the UK.
Okay.
England.
And okay, good. And can I know what type of work he does?
Yeah, he works as a driver.
Driver, okay. Thank you for sharing this, Jerry. I also want to ask you a few questions about you. Do you have any past history of sexual transmitted disease?
No.
Okay. And by any chance, do you use any recreational medications?
No.
And may I know if you're also your partner if you use any recreational medications?
No.
Okay. And with this burning micturition, may I know if you have any penile discharge?
No.
Okay, thank you. Did you have any other symptoms?
No.
Like tummy pain, feel sick?
No.
Okay. And what about the urine? Any change in color?
No, I didn't notice any change in color.
Only you mentioned burning.
Mm.
Okay.
No.
Can I know more about your past medical history? Do you have any chronic health condition?
No.
Okay. Are you by any chance on any medications, even over the counter?
No.
Okay. And are you allergic to anything?
No.
Okay. Did you ever have this condition before?
No.
Okay. Okay. Jerry, can you tell me if you have any idea what's causing your symptoms?
I don't know. I don't know.
Okay. And can you tell me if there is anything concerns you?
Yeah, I'm worried that is I got any serious problem.
Okay. Okay. So I appreciate your worries. I will tell you what I'm going to do. Okay. I will just check your vitals and examine your tummy. And I want to run some investigations. I want to check your urine. Okay. And your full blood counts and inflammatory markers. I'm suspecting this may be due to infection to your urine, or it is also maybe a sexual transmitted disease. Okay.
Okay.
So you mentioned earlier that you had unprotected sex with your partner. So we just need to be safe. I want to refer you to gum clinic and run some investigations for HIV or hepatitis B virus. And also you mentioned if you can correct me, you did this sex 2 days ago, correct?
Yeah.
Okay. So we also need to give you medications called post-exposure prophylaxis. So if there is any risk for HIV, to prevent this risk from happening. How does that sound for you so far?
Yeah. Okay. Thank you.
Okay. And we're gonna check the investigations, and we can decide for which medications would be best for you.
All right.
Okay. Do you have any other questions or concerns?
No.
I just want to advise you to use condoms and use protected sex, and try not to donate any blood or have sex unless protected until we can know what's wrong with you. Okay. And receive treatment for that.
Okay.
Okay. Thank you, Jerry. Any question?
Thank you.
Thank you.
So what do you think is the high risk or low risk, guys?
Low risk.
Men, sex with a man is
High
a
risk.
low risk.
High risk.
High risk.
High risk. Yes, that's correct. High risk. You need to say to this patient, unfortunately, you are at high risk of the sexually transmitted disease. That's why I want to keep you here. Okay, I will do the examination of your genital area. You guys are missing this important point. I told you, you need to tell the diagnosis differential, then you go for the examination, then you go for investigation, then you go for management plan, then you go for advice. These are the steps you need to follow. Okay, I will do the examination of your genital area, look, feel, okay? Because sometimes you need to touch it, you can need to check it. And the good news is that you had unprotected sex 2 days ago. So you're eligible for post-exposure prophylaxis, okay? You also need to mention. And the for bacterial coverage, I will give you another medication also called antibiotics. So you need to mention or not, no problem. And then I will refer you to the gum clinic for more screening. They will do the special tests, which include for hepatitis B, C, etc. You need to mention HIV, okay? And you need to, your partner also should be treated, okay? You need to ask your partner to come up and treat his condition. Likely he has also the same problem. You need to mention that. And the advice for you is that do not donate or receive any blood till your screening shows negative or it's normal. And if you wish to do a sex this time, or you want to do any sexual activity, use the barrier or condom. This way you need to explain it. Not like I told you the steps, the diagnosis, go for the examination, investigation, management, then advisors, steps follow. It's very important. And another thing, the systemic review, okay, no problem, you tried well, but try to focus more on systemic review. So if the urethral discharge came the patient to you, then you need to follow genitourinary system, means go follow the sequence from genital regarding, you need to ask the question, then you go for a urinary system. Same if the patient came a burning micture, then first the urinary system, once urogenital. Okay, so this way you need to make it upside down or down up. Okay, clear so far, guys? So this is where you need to go. So, and this about the sexual history. And the consent is very important. You need to take it. Okay, next we are moving to next station. Okay, please read this the condition. Just give me 1 second. I mute the mic, please. Okay. Just give me 1 second. I have something to do very early.
In the big the last 2 weeks. Am I right?
Yeah.
Okay. So would you mind if I examine you based on your symptoms? I examine your tummy and your rectum for any disease.
Okay.
Okay, thank you very much. So based on your symptoms and after examination, you may be suffering from some gastric ulcer, or it may be, unfortunately, maybe some sort of cancer. So for that, we have to run some investigations, and after that, we will decide for further payment. Is that okay with you?
Okay.
So meanwhile, we have to give you stool softener and some drugs, and after that, after the blood result came, then we will treat you or will refer you to a surgeon, for surgeon or gastroenterologist for management accordingly.
Okay.
Do you have any questions so far?
No.
So, are you suffering from any systemic illness like cardiac diseases, any chronic disease like tuberculosis?
No.
So, do you have any other question?
No.
Okay, thank you very much.
Yeah, thank you. What do you think, guys, was the problem with Mr. James?
Peptic ulcer.
Peptic ulcer due to
Yeah, I'm
using
bleeding.
of ibuprofen.
Yeah, I think.
Yes,
Yeah.
it's peptic ulcer disease. It's very simple station. Anyway, good try, Rafi. You tried well. Please try to follow the approach I said you before. Okay, the bleeding already intensity, you ask question in ODP are good. Then you need to go further. Is there anything make it worse, better? Then you come up systemic review. So what is the relevant system here, guys? GI, right? GI. So I said the nausea, you need to ask more question here. Is there any, did you any vomit recently? Or any vomiting, any episode of vomiting, any changes apart from any change in bowel apart from the blood? So I can tell you. Then you go for the next system. You can go for urine and etc. Then you need to go for miscellaneous. Okay. Any temperature, any wet loss, or anything to rule out. As I said, I'm concerning of a cancer. So how would you rule out, right? You don't, after two system, you need to follow miscellaneous, then you need to continue for further system. If you do not do so, this is, okay, this you ask me in the drugs. So I told you drug history that I am taking the ibuprofen. So this is the most commonest cause, NSAID or the peptic ulcer disease. Okay, so it's very clear, obvious, but you need to follow the system. So the treatment here, based on your information, the most likely problem you are having a sore in your stomach, a sore, not a peptic ulcer, but you say a sore in your stomach, which is likely cause in your case is the medication. You said you are taking ibuprofen last 2 weeks, so they are the most likely cause. So what I'm going to do, I'm going to first keep you your observation, give you fluorovein if required, and also do examination of your tummy. And then I will involve the gastroenterologist to do a camera scan. If it's confirmed or how big is the large the sore, then it would be treated with the camera scan. Okay. So you need to mention, and then advise, come up to advise you need to avoid coffee, you need to avoid these drugs. You must need to mention these drugs should be stopped or at least to be covered with the dose of should be decreased. So advise you will give, avoid caffeine, avoid any spicy food, but you need to mention the investigation complete, like full blood count you will do. Okay. So the first diagnosis, suspicion, and then the examination you will say him I will do. Then you will come up to investigation. I will do full blood count and the H. pylori test, etc. And if record the camera scan, then you need to go for the treatment. Okay, treatment plan, like you will give the fluids. Okay, and some, if required blood transfer, you say it will depends on your blood results. If required, I will give you. So likely in patient in this history taking will be not severe, right? Maybe one time twice a bleeding, so fluid is enough to give. And then you need to mention the endoscopy, and after endoscopy, you will give the treatment of the omeprazole, like PPI. Okay, and you also forget the score here, the guideline, like Glasgow.
PBS.
Here you need to mention the score. Okay. Anyway, good try. So I want to say that the upper GI bleed can become of different ways, either the vomiting or they're in these two. So you need to be very, very careful when you take the history. Okay, so next one. Who wants to? We have one more station, a few more station. Anyone? Could you please raise your hand? I want to see that who is ready for that. No worries, you just try and I will help you. Okay.
Okay.
Okay. Ryan Abdallah, right? Ryan Abdallah. I'm sorry, I cannot pronounce very well. Maybe. Okay, sure.
Yes, right.
Okay, so this is your station.
Hello, I'm Dr. Ann, emergency registrar. Can I know your name and age, please?
Yeah, I am Joan, 38.
Okay, can I know how can I help you today?
Yeah, it's like that I have women's blood today.
Okay, I'm sorry for that. I would like to move you to resuscitation area, just check your vitals and make sure you're okay. Would that be okay?
Okay.
Okay. So I want to take more details from you about this vomiting blood. Okay?
Okay.
Okay. Do you want anyone to attend with us?
No problem. If someone.
Okay. Okay. Can you tell me more about this?
Yeah, Dr. States, before I had some problem too, but it wasn't like that. But now I vomit blood and I feel exhausted.
Okay. May I know when did it start?
Today morning.
Okay. Did it? May I know how many times did you vomit blood?
I had 3 times, 3 episodes I have.
Okay, sorry for that. And can you tell me the amount approximately?
I would say half cup.
Half cup. Okay. Was there any clot with it?
I haven't noticed. It looks a little bit fresh, yeah.
Okay. Okay. So I understand it was bright color.
I would say it can be bright, yeah. It's sometimes bright, sometimes a little bit dark, yeah.
Okay. And did you have? Well, did you also feel sick?
Yeah, I do.
Okay. And did you notice anything that makes it worse or better?
No. No clue.
Any other symptoms with it?
Okay. Continue.
Hello?
Yeah.
Yes. Any other symptoms with it?
I just feel burning before, yeah. No, other than that.
Okay. Did you bleed from any other side?
No.
You noticed any rash?
No.
Okay. Do you feel dizzy?
Yeah, today I feel after vomit, yeah.
I'm sorry for that. And you mentioned you felt heart burning. Was there also any chest pain?
Yeah, I had it, but today I vomit, yeah, before I had it.
Okay. Any heart racing also?
No.
Any difficulty breathing?
No.
Okay. And may I know if you have any other symptoms? And what about your bowel movement? Any change in that?
No.
Any change in urine?
No. No.
Okay. Did you notice any change in your weight recently?
No.
Okay. What about your appetite?
Today is not good. Yeah.
Okay. Did you have this vomiting of blood previously?
No.
Okay. I would like to know more about your past medical history. Are you known to have any health condition?
No.
Okay. And are you on any medications, maybe blood thinners like aspirin or warfarin?
No.
Okay. And are you allergic to anything?
No.
Okay. Can I know more about your social life? Do you drink alcohol?
Yeah.
Do you know how many units a day?
I think 10 units a week, probably, even sometime more.
Okay, okay. And do you smoke also?
Yeah.
I know how many cigarettes?
10 packs a week.
Okay. And do you have any past medical history of any liver problem?
No.
Okay. Can you tell me if you have any idea what's causing your symptoms?
I don't know. I feel like something goes wrong, seriously.
Yes, I appreciate your concern. Can you tell me if you have any other concerns?
No. Just want to get fine.
Oh. Yes, okay. I'll do my best to take care of you. I want to shift you to, we are already in research room, okay. I just want to examine you properly and check your vitals again. And I want to examine your tummy, okay? And your chest. Also, I want to, I'm suspecting maybe this due to drinking, because you mentioned sometimes you go more than 10 a week.
Yeah.
So many causes can cause this. We need to make sure first, check liver problem first and rule other causes. Like it can be a problem in your stomach or maybe a bleeding problem. So we need to take full blood counts. We need to take blood grouping, cross-matching, and do a bleeding profile. And check your inflammatory markers, check your liver function. Okay. Also, I want to do chest X-ray and a tummy scan. Also, I want to consult the gastroenterologist for your case. We may pass a camera scan through your food pipe. Okay. Also, we'll check your stool, make stool analysis. Are you following me?
Yeah.
Okay. Do you understand my plan so far?
Yeah.
Okay. I also want to advise you regarding alcohol, not to go more than 14 units a week. And once investigations are ready, I will come to update you.
Okay. Thank you.
Okay. Thank you.
Okay, good try. Here is the cause, most likely peptic ulcer disease, not alcoholic liver disease, because his specs are normal and he is not diagnosed. So, anyway, you don't need to tell anything clearly, but what you can say, the most likely problem, based on your information, the most likely problem in your stomach is can be sore in your stomach, but it can also be problem in your liver. As you, or in both situations, both can be it's differential, but I need to rule out. Or you can say, based on your information, the most likely problem, there is a sore in your stomach, but I need to rule out liver problem. As you said, you are drinking alcohol, so this might be the cause of your condition. It's because alcohol also causes the peptic ulcer disease. Okay, so then you should say, I will keep, guys, you guys are making mistake to transfer the patient in the beginning to research room. This is history taking. It's not necessary to transfer to the research room in beginning. When you find out the diagnosis and you think it's recorded, then you need to say, therefore, I will move you to research room, connect to the monitor, check your vitals that you're okay, and I will examine your tummy. Why that will include look, feel, if required, listen. You need to mention what you will do in examination. Why do you do? Because you want to rule out maybe liver enlargement, anything. Okay, hepatic megaly you can do. I will examine your tummy. It will include look, feel, listen, and I will do some test which includes your tummy scan, to include full blood count, one bacterial special test which is called H. pylori antigen, and I will do ABG, other tests, and one more test maybe you require. For that I will involve the gastroenterologist to pass a tube from your food pipe from your mouth towards your stomach to check the sore in your stomach. How big is it, or is still bleeding or not? Okay. And apart from that, if it's required, if it's bullied, it need to be stopped. We will, the gastroenterologist will stop bleeding with clips and inject a drug called epinephrine 2. So you need to mention that. Okay, and after that, you will get some medication called a proton pump in omeprazole. Just mention that this medication you need to take it, and also you will be arrange follow-up with the gastroenterologist for further management if you want to make sure. The advice leaflet will be given, which includes the advice or following advice you will be given: avoid caffeine. Okay. Decrease the alcohol consumption, smoking, etc. You will mention. Okay, so this is how you will say. And you said about like research room in the beginning. Okay, you do well, but it's better to say in the end. Okay, and follow the way. The most likely rule out the cause, come up to the examination, come up to the investigation, come up to the management, and then advise. This sequence you need to follow. Okay.
Okay, thank you.
Yeah, but the most likely alcohol also cause peptic ulcers. It's not only about you think, because the alcohol consumption is just like 10 units per week is very low, not really high. Okay, so any other who wants to practice? Yes.
I have one question, please. Can we ask question 2 or 3 questions in a row? Like did you have any shortness of breath, cough, or weight loss in the same one sentence question?
No, guys. The problem is that I know sometimes you guys are thinking like it's very long station. Believe me, this is very, very short station. The problem is that you are just started practicing, right? When you practice again and again the same approach, or get familiar with this everything, you will never even think about it. You will go very fast. Okay,
and
so
you mentioned one other question, just one question. Sorry to disturb you.
I will give you time to. I will give you time to ask me any question you want later. Okay. Okay, let's come up. There's another. Ryan did it. Okay. I don't know what's his name. There is another guy. I don't know. Abi S.
Yeah, Abbas Abul Qasim, yeah.
Abul Qasim. Okay, I'm sorry.
Exactly, doctor.
It's okay. So, okay, let's come up to next station. This one for you.
Yes, hello. I'm Dr. Abbas Abul Qasim. I'm ED registrar. May I know your name and age, please?
Yes, I am Miss Oliver. I'm 68 years old.
Yeah, nice to meet you. How can I help you today?
Yeah, doctor, I went to the washroom and I had a stool and this was blood and I'm really worried about it.
Okay, sorry for that. Are you comfortable now, or you want me to offer you any painkiller?
I'm okay.
Okay. So can I take from you some information regarding your problem?
Okay.
Okay. Do you want anyone to attend with us?
No, it's okay.
Okay. So can you tell me more about your problem?
Yes, doctor. Is started last night. I went to bed very late, and I don't know what's happened. I feel a little bit uncomfortable in tummy, and I went to toilet, and I found there was a lot of blood came up, and I don't know. It's a little bit dark stool. Yeah.
Mm-hmm. So can you tell me about is it start suddenly or just gradual?
This doctor is today morning. I mean, suddenly, yeah.
Okay. How is the amount? Can you estimate for me approximately how much is blood in your book?
I cannot say exactly, but it's moderate, I think.
Okay. How many times did you pass this?
Since
blood?
then, one time. Yeah.
Okay. Is it mixed with stool, or at the beginning, or after you pass normal stool?
I think it can be said mixed, or and also can be both. Yeah.
Okay. What color exactly? Is it like bright red or dark or?
Oh, it's a dark. Yeah.
Any other associated, like any secretion like mucus or with your poo?
No clue, doctor.
Do you feel any tummy pain?
Yeah, I had a little bit tummy pain. Yeah.
What does it look like? The tummy pain? It's like something squeezing you, or how you can describe it?
Yeah, I could say a little bit cramp.
Mm-hmm. Okay. Any other associated like symptom? Do you have nausea or?
No.
Any fever or?
No.
Okay. Do you have any other symptom, like do you have any skin rash or?
No.
Okay. So do you have any loss of appetite?
No, in the morning after I went to washroom, I had a breakfast. Yeah, so it was okay. I barely took it because I feel dizzy as well. Yeah.
Did you notice any change in your body weight recently, or?
No.
Do you have any other symptom like chest pain, difficulty in breathing, or?
No.
Any blood from anywhere? Do you have vaginal bleeding or?
I haven't noticed yet.
No vaginal, sorry, no vaginal bleeding?
No.
Okay. Do you have any medical problem?
Yeah, doctor, I have COPD and one more condition. Yeah, I don't know what to say.
What medicine did you take? Are you on any regular medication?
Yeah, my GP prescribed me one medication is inhaler. Okay, and one more medication for pain and and also give me the warfarin. And I don't know for what it's still now. I'm taking from long times. I don't know for what he prescribed this medication to me.
So for how long are you taking this warfarin?
From last few years.
And do you know the medication the GP prescribed for you?
Yeah, this warfarin.
No other medicine with warfarin? Inhaler, okay. Understand.
And the blood thinning control the blood pressure too.
Okay, so do you have any allergy to medicine?
No.
Can I know what you are doing for a living? What's your job?
Oh, I'm reading books at home. Good job.
Okay. Do you smoke?
No.
Or drinking alcohol?
No.
Did you travel anywhere?
No.
Okay, can I know what's your concern?
Yeah, doctor, do I have a cancer?
I appreciate your concern. So I'm gonna keep you on the observation room. I will examine you. I'll examine your tummy. I'll examine your back passage, and I will do for you some blood test. I will test your coagulation, and I will do also complete blood count, and I'll check your stool to and also I will arrange gastroenterology referral. Mostly this problem related to the medicines that you are taking. This warfarin, we need to check your coagulation profile. So meanwhile, we need to omit the warfarin dose, and we need to check the what is called the bleeding time, this the INR. So if this problem related to warfarin, we need to give you medicine like what is called vitamin K. This will help to treat your problem. So I will inform also our gastroenterology doctor. Do you have any question?
No, thank you.
Okay, thank you.
Okay, good try, good approach, but still need to work hard. Okay, so the diagnosis, yeah, this is the cause of his condition is due to blood thinning medication. In case in this patient is warfarin, right? So based on your information, the most likely problem you're having, bleeding in your stool, is due to the medication you are taking called warfarin. I will move you to the research room because this patient need to move to research room, connect to the monitor, check your vitals test, you're okay. Okay, I will do the examination of your tummy to see if there are any other problem like mass, can be, need to rule out, okay. I will do the investigation, which include full blood count, blood profile, or you can mention coagulating screen. And I will do the tummy scan. If your blood profile come abnormal, so we have a scale to treat this this abnormality. We don't have a name for that, but warfarin limitation, right? If it is greater than 5, if it's greater than 8, so you need to say about that. So if we will see how abnormal it is. So according to that, we will give you a medication we can give you through your vein. So vitamin K, you can say if you want to say. I will also give you the some fluid through your vein. You need to mention that, okay? Yeah. And I will arrange. I will involve the gastroenterologist to check. He will do a camera, a telescope with camera to pass from your down part towards your belly to check out how bleeding is. If it's continuous, we will stop it. Okay, means to clamp down it, or we use a drug to stop it. Another way is also, but you must make sure that you need to stop this warfarin. Okay, warfarin should be stopped. So you need to do like that. So colonoscopy is all any patient, regardless of the cause, if it is medication or anything, you have to go for. This is the guideline. Okay, so this is how you will say, and then we will decrease the dose of warfarin, or we will change the medication accordingly. That's it. But you should follow. What?
Hematologist also?
No. It's not the cause in this patient is likely this warfarin. It can be managed in the ED even. You don't need, just do a gastroenterologist that's bleeding continue or stop. This is very important. Because if patient continues bleeding until the effect, so of course patient will go in severe cases. So that's why we just do it. Or sometimes we do the colonoscopy to rule out other causes. Clear?
Okay.
So any patient come up to you with lower GI bleeding, apart from the hemorrhoids, you need to go for a colonoscopy. But you need to go first line treatment like resuscitation. You have to do. Patient need to require resus to move to the resus, need admission, admits, whatever you have to do. But this is the standard plan which I told you just now. Okay, so next you have done, and next is Sarah. There is a girl, Sarah. Okay. Sarah?
Yes.
Are you ready?
Yes.
Okay, good.
It's my scenario.
Is it clear to you, this slide?
Yes, wait, please, because I am using mobile. Okay. Hello, I'm Dr. Sarah. I am ER registrar. May I know your name and age?
Yeah. I am Freddie. I'm 26.
Okay.
Sorry, 55, sorry.
Okay. May I know your problem?
Yeah, doctor, yesterday I came back from my work and I went to place to the toilet, and I don't know, I found something change in my urine. Yeah.
Okay. You have any pain to over your painkiller?
No, I'm okay.
Okay. You have anyone with you? You want him to attend?
No, it's okay.
So I can bring my nurse to attend with us as a chaperone. Can you tell me about your problem, more details?
Yeah, I don't know when it started. I don't know why I'm having this problem from last 2 days. Sorry, today in the morning. Give me 1 second. I need to close these. Okay, thank you. Yeah, continue, please. I had this problem since yesterday when I came back from work.
When? Yes. Tell me more.
Yeah, I don't know what is the problem, but I need to frequently go to the toilet, and it's changing color.
This only started yesterday?
Yes.
Okay. Is it the color of urine bright red or dark?
I think it's dark.
Okay. Any clot passing with this urine?
I haven't noticed.
You have any bleeding from other side of body?
No.
You feel any pain when you passing urine?
No, I don't feel any pain. Like I don't think so. Yeah.
Okay. Do you feel that when you passing urine, still your bladder not empty?
No. I don't feel nothing like that. Yeah.
Do you have passing urine before you reach toilet? Cannot control.
Today I feel like that. When I came back from work, yeah, frequently, yeah.
Okay. Sorry for that. Do you get up in middle of the night to pass urine?
Yeah, twice. Last night, twice.
And you feel any difficulty when you passing urine?
No.
What about your urine stream? Is it weak or normal?
It's weak.
Okay. You have any loss of weight?
No.
You have any loss of appetite?
No.
Okay. Do you use any blood thinner medication like warfarin or aspirin?
No.
Do you have fever or temperature? Your temperature?
No.
Do you have throat?
No.
Any burning micturition?
No.
Okay. You have any history of travel?
No.
You have any past medical history?
Yeah, I have hypertension. Yeah, high blood pressure.
Okay. You are on treatment.
Yeah, I take one sachet for that.
You have any past medical surgery?
No.
You have any family history of same like this problem?
No. My dad has he has enlarged prostate. Yeah.
Do you have any allergy or?
No.
For any medication? Do you use alcohol? Drink alcohol?
No.
You are smoking?
Sometimes.
Okay. What is your concern?
What's wrong with me, doctor? It looks like some serious, maybe.
Sorry?
What's wrong with me, doctor? I maybe serious problem. My one of friend has the same problem, and then doctor told him he has a cancer.
Okay. I appreciate your concern. I will put you in observation room, and I will assess. I will attach to your monitor. I will check your vital sign, and I will do full examination, and I will examine your tummy and back passage also. And most probably you have in this age you have enlargement prostate, but we need to confirm that by doing some investigation for you. I will do some lab investigation. I will do for you full blood count, and I will do for you blood group and cross matching if we need for any blood transfusion if your blood down, and also will use for you prostatic specific antigen. This one special test for prostate. It is like a marker for
tumor of prostate. And also I will do for you some I make for this scan for prostate. It is ultrasound, and also will do for you a camera scan. Is it clear?
Okay.
And also I will call urologist for more diagnosis for you. Did you have any question?
No, thank you.
Welcome. I will update you for result.
Okay. Okay, guys, what do you think was the problem in this patient, Freddie?
Maybe BPH. Maybe nephritic syndrome.
Yes, glomerulonephritis or nephritic syndrome due to high blood
we
pressure.
have to ask more medical history, and we have to ask any other swelling.
There's the prostate.
Or lower limb edema.
Yes, because the problem is that when you don't follow the systemic review, all of them, like all the time, the candidate are missing miscellaneous, right? So you need to ask more and more. In this case, the patient has glomerulonephritis due to the scarring of the glomerular membrane. So the inflammation has been due to high blood pressure. High blood pressure do cause this problem. Okay. Anyway, so this is you can say there is likely inflammation in your kidney. The prostate his enlargement. So of course he should have the voiding substance, right? He should have dribbling. He cannot empty his bladder. But in my case, there's no any problem. I go frequently, right, and pass the urine normally. And another, the color is changed, and no weight loss history. So you don't need to think for that even. So the diversion, to make diversion, is the family history of prostate. So it's just like to divert you to other diagnosis. Actually, the diagnosis is this one, high blood pressure, he said. And due to that, he's taking also medication already for it. So this is the cause of his the symptoms.
What is the case for this one besides this hypertension? Red urine?
Oh.
Hematuria?
Yeah,
high blood pressure?
Yes. The high blood pressure, I told you this, if the patient is long time high blood pressure, so likely there will be scarring of the glomerular membrane. So that's why the inflammation has been developed there. So this is, in the exam, of course, you will have the clear picture, but I just mean is that this station has came already. So just put some light on it. Anyway, no problem. You did very well. So sometimes you don't need to go exact diagnosis, but you can go like this way, based on your information. The most likely problem in your kidney, it can be inflammation, but I need to rule out other causes. Like you said, your dad has the enlarged the prostate. So I need to keep you here in observation or research room. I need to check your vitals that you're okay, and if required, the fluid will be given through vein. I will do investigation. Following investigation, you need to. But if you suspect, I would say the prostate, then you need to say, I will. We have a special scale like international, the prostate score, I think is the name. So we use it, and accordingly we find whether you need to treat or not. So this is how and I think so last the previous webinar I discussed about it. Anyway, good try. Thank you. What's your name, please? I forget your name. Yes, Sarah. Okay, so we are going. Yeah, so what is the treatment for glomerulonephritis, guys? I didn't tell you the treatment. What would be the treatment? Yeah,
control blood pressure.
Yes,
control blood pressure.
Yeah, that's correct. The patient will also due to
ACE inhibitor.
ACE inhibitor, underlying ACE inhibitor. They also need to aid in case he develop edema or anything, the diuretic.
Yes.
Okay.
Yeah.
And refer to the follow-up with the nephrologist. nephrologist
Main treatment
follow-up.
of glomerulonephritis is based on the cause. What is the cause of the
Yes,
glomerulonephritis?
that's correct. There's the main, but we need to give the patient the emergency treatment, and then we refer to the nephrologist, the rest of his specialty, also involve the medical team to focus on the hypertension. Okay, and the advice is you will avoid sodium diet all the time. Nephritic glomerulonephritis, nephrotic syndrome, almost nearly same everything. So treat underlying cause and give symptomatic treatment and refer to nephrologist. Okay, so the next we have the Sarah, then we have Zishan. Dr. Zishan is there?
Yes,
Are
sir.
you ready?
Yes, sir.
Okay,
Yes,
okay, good. This is a very important station, and I just want to give you a little bit overview. You see the 50% information gathering, 35% differential, and the clinical reason 15%. So less likely you will reach the exact clinical decision, but you need to tell according to the condition which we discuss in vaginal bleeding. So Zishan, you do it, and I will ask one more candidate to do it if someone want to wish.
Okay. Hello.
Yeah.
My name is. Good morning.
Yeah.
Okay. My name is Dr. Zishan. I'm ED registrar. May I know your name and age, please?
Yes, I am Melly. I'm 68.
Okay.
Oh, sorry,
Personally,
55.
okay, nice to meet you. May I know what brought you here?
Yeah, doctor, I noticed in the morning I wake up and I notice blood here under my undergarment.
Okay. Okay, sorry to hear about it. Do you have pain?
No.
Okay, so I can continue. You don't need painkiller, right?
Yeah, I'm okay.
That's fine. Could you tell me more about your vaginal bleeding, please?
Yeah, it started today morning, and since then, yeah, it continues. I found it's coming a little bit again and again. Yeah.
Okay. So, is it okay? How many times a day almost does it comes?
I think I already changed 3 to 4 pads. Yeah.
Oh my God. So is it getting worse with time?
I think, yeah, it is.
Is there any clots?
Yeah, I found some class too.
What make it worse?
I have no clue. I haven't noticed what
Right.
it makes.
How does it improve?
I don't know.
Okay. Is there any other symptoms which is linked with it, like abdominal pain, fever, vomiting, pelvic pain?
No.
Right. So, may I know, if you don't mind, I want to ask you about some personal history that you have any sexual contact in the last few days?
Doctor, it's a postmenopausal women.
Okay. So, you are postmenopausal, right? So, so do you take any medication?
No.
Okay. Right. Do you have any abdominal pain or diarrhea with it?
No.
Okay. Do you have any weight loss?
No.
Do you have any um, do you have any shortness of breath or cough?
No.
Okay. Do you have any chest pain?
No.
Do you have any headache?
No.
Right. So, okay. Do you have any drug allergy?
No.
Okay, right. So you're not on any medication, and you have this. I want to summarize that you have this short onset with 1 day history, almost 3 to 4 times. You have PV bleeding. You are postmenopausal, and do you have any dizziness, anything?
No.
Right. So, may you have any family history run in your family? Any
No.
medical problem? Right.
No.
Do you smoke or drink?
No.
Do you take any recreational drug?
No.
Okay. So, I want to know that what is your concern? What do you think about your problem first?
I check on the
What do you-
internet. I found that maybe I have a cancer.
Right.
I'm worried about it.
So you're right. You're right. This is really worrisome. So, what is your expectation to come to the hospital?
We want this problem should be resolved.
Right. So, actually, on the basis of the basis of the information I collected, the data I collected, actually, there are few postmenopausal conditions which is linked with this bleeding. I cannot diagnose this case on this basis, but there are few things which I can tell you that there is an atrophy of the vagina, which all the endometrial this one atrophy which can lead to this one. This is the inflammation or the thinning of the vaginal lining of the or the womb lining because of the low estrogen level after postmenopausal. This can be the one reason. There can be the growth of the tissue, which is usually non-cancerous. This can be another cause. And there are a few more causes, as you mentioned. It could be cancer, which is less likely, but I need to investigate you, and there could be endometrial hyperplasia. There is because if you are on the hormonal replacement therapy, I didn't ask you, but if the patient is on the hormonal replacement therapy or with a high estrogen level, so it could be possible. So in this condition, I would like to do few tests, few hormonal tests, and few blood tests, and then ultrasound of your pelvis to see any mass, anything, any abnormal growth, and I will do the PV examination with the chaperone with you, and after that, I would like to declare the result on the basis of the biopsy if it is required. Do you have any further question?
No.
Okay, thank you very much. So just wait for your test, please.
Okay, first of all, you did a lot better than the previous last station. Okay, you tried to explain the differential, but you forget to tell their each one by one treatment. Also, after that, you need to go for investigation. Okay. So yeah, the investigation, 3 important investigation. One is specular examination. You under chaperone, you will do. Another is the transvaginal scan, and third is hysteroscopy, which will done by, I think so, gynae, obs and gynae, but 2 that you can do it in the ED if you are familiar. So you need to explain these investigation, simple words. Well, you could try, but history is not complete. You haven't ruled out the drug causes. Maybe patient is on the blood thinning medication. Okay, in this case, maybe, yeah, if the patient is on blood thinning medication, so this is likely the cause, right? Then you say, I need to rule out other causes like the vaginitis or the polyps, etc. you will mention. But if you haven't got the history of blood thinning medication, patient deny then you use the differential including the treatment way. But if the patient give you the weight loss history along with it, then can likely to be cancer, cannot be cancer, both.
Right.
So anyway, you need to follow the approach nicely. You guys are skipping many things. Try to do not skip everything. Try to cover each and everything that you should know on a fingertips. Okay. Okay. So anyway, good try. And anyone who wants to practice the same station?
I can do it.
Me, I want.
Okay. Yeah. The one who didn't did this station, please let me know so he or she can start it, because I don't see the name here. Let me see. Yeah, here is the Sean did it.
Me, I didn't practice.
Okay, so you do it. Okay, if you didn't practice, you do it. Okay. Sorry, the same station. We need to go back. Okay. Do you want to see the case or just move it?
Yes, I want to
15.
see.
Okay.
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 I can start now.
Yeah.
Okay. Hello, I'm Dr. Lina, one of ED. Doctor, may I know your name and age, please?
Yeah, I'm Grayson. I'm 55.
Welcome, Mrs. Grace. How can I help you today?
Yeah, doctor, I noticed in the morning when I wake up from my bed and I found some blood
Okay, sorry
in
for
my
that.
in my garment.
Yes.
Yeah.
Okay. So just I need one nurse to attend with us if didn't mind.
Okay.
Okay. So tell me more about your condition, about this vaginal bleeding.
Yeah, doctor, is started in the morning, and I saw in undergarments, and then I put the patch. Yeah.
Okay. So according to what you said, it is just started today on the morning. How many times you got bleeding since morning?
Yeah, I changed around 6 or 7 pads already.
Okay. Any clots?
Yeah, I found some class 2.
Anything increase the bleeding?
I have no clue.
Okay. Anything improve?
No idea.
Okay. You feel any dizziness or any fainting or anything since morning today?
Yeah, I feel now dizzy. Yeah.
Okay, sorry for that. So just I need to keep you in recess area, and also I want to check your vitals and keep you on monitor. Okay.
Okay.
Okay. Any tummy pain?
No.
Any diarrhea or any feeling sick?
No.
Any urinary symptoms?
No.
Any change of your weight or appetite recently?
No.
Any temperature?
No.
Okay. You said you are feeling dizzy. Any heart racing or any chest pain?
No.
Okay. Just I want to ask more few questions about your menstrual condition. You are, I think you are postmenopause.
Yeah.
For how many years?
2 years.
Okay. Did you take any hormonal therapy?
No.
And what about your parity? How many boy or girls you deliver?
I have one son.
Okay. So let's move for your medical condition. You have any chronic disease?
I just have around 1.5 years ago, I had a heart attack. Yeah. So doctor prescribed me some medication.
What is that medicine, you know? Is it blood thinner or anything?
I think yes. Yes, he told me you need to take 1 year or more.
Okay. You have any disease on your genital, in your uterus, or your ovaries, or anything?
No.
When last time you visit your gynecologist?
I was there maybe 2 years ago. Yeah, I feel uncomfortable. Yeah.
Okay, everything was okay, he said?
Yeah.
Okay, good. You have any family history of any cancer disease or anything?
No.
Okay. You have any allergy for any medicine?
No, I haven't found any allergy.
Okay, good. Sorry, let's just back for a little information more. Just bleeding from vagina. Any other part you notice bleeding today?
No, no.
Okay, good. You want to add anything?
No.
So let's summarize. If anything, correct me. You just said you are having bleeding since today morning of considerable amount. You are changing your pads about 6 to 7 times. It's also contain blood, and you are feeling dizzy. And also, you said you are having a heart problem, and you are using you diagnosed previously, and you are using blood thinner medication. So just according to data I collect from you, I want to examine you fully. I want to examine your tummy, and also I want to do. I want to insert some plastic machine inside your vagina to see what is going on, and also I want to do for you the vaginal test called vaginal ultrasound. So probe I will insert on your vagina, and also may need gynecologist to do for you some scan for your uterus and for your genital area. Is it okay for you? And also we are going to do some blood test like full blood count and coagulation profile and renal function and electrolytes. Okay.
Okay.
Okay. And also I will insert for you 2 large bore cannulae, and also give you some and also I will give you fluids. And also may need to take blood grouping and cross-matching if we need to give you blood. According to data, it is most likely maybe due to just blood thinner you are taking, or maybe due to disease running in your cervix or your vagina.
Okay.
Or uterus. Yes. Okay. Anything you want to ask me more?
No, thank you.
Okay, I'm here just for helping you. Anything, I am around. Thank you.
Okay. Thank you. What's your name, please?
My name is Lena.
Dr. Lena. Okay, Dr. Lena.
Yes.
So you did well. You asked the menstrual history. When was your first period? When was your last period? Even you don't know the postmenopausal, this can give you clue. If greater than 12 months, no period, that means this lady in menopause, postmenopause. Okay. Got it?
Yes.
Another thing is that the management plan, it wasn't concise. You need to say based on your, okay, if you use according to your data, no problem. What else looked better to you? But you need to say that based on your information, the most likely problem you're having due to the medication which your blood thinning medication for your heart condition which you're taking. But I need to rule out some other causes, which are, so you need to mention what could be vaginitis, polyps. So therefore, I will do the cancer. So what I'm going to do, I want to keep you here in research room. Okay, bleeding patient,
Yes.
a lot of bleed. Research room, connect to the monitor, check your vitals, and do the examination of your vagina with a plastic device called speculum to keep it open to see inside cervix and your womb. But you need to say, I will do it under chaperone. Chaperone need here. Chaperone doesn't need when you're taking history, okay? Why do we need a chaperone? Mostly we need a chaperone in this kind of when you are doing examination, not in when you are taking history. Clear? So better to when you mention the chaperone, you need to make sense that it really makes sense. So do the examination under chaperone, and I will also do the scan. A device will be inserted from your vagina to scan the device, to scan your parts. I will see if there is any other abnormal like polyps, etc. Then you say, if it's confirmed polyps, I will refer you to the removal. If it's confirmed you have vaginitis, then I will give you a cream which you will apply. If there is cancer, so I will refer you for removal. Just need to mention the treatment plan done. Clear?
Okay. Yes.
Other tests like blood, this is not very important. Okay, not very important for this station. The important are these: speculum, the transvaginal scan, and the hysteroscopy. These are the most important. Okay, so important, never miss it. And then you refer what else relevant to specialty you have to do. But overall, you need to mention the diagnosis, what could be, what could not be. If it's confirmed, I will do this. If it's confirmed this one, I will do this. So this is concise and to the point, everything clear. And the things you already mentioned, most likely medicine, yes, it can be most likely mentioned, but you need to, in this gynecologist, any patient relevant to gynae, it's very complex. Okay, so you need to put differential and talk about them. Okay, very good, well done. And you still need to follow the system. You start from, I don't know, GIT. So don't need to start from J. It's vaginal, so genitourinary first, okay? Not GIT.
Okay.
So I will see where I can correct you guys, because sometimes candidates are mixing everything, so I don't remember where you made a mistake. But when I found that you are going with, if 1, 2, 2, 3 mistakes, I can correct you anytime, because it's easy to pick up. Okay, let's go for the next station. I think who wants to practice? There is anyone to practice apart from Zishan?
Can I try? Can I try, please?
What's your name, please?
Dr. Twaiba.
Oh, okay, Dr. Twaiba. Okay, you can try, no problem. Everyone can try. Next station, right? Okay, this patient is traveling diarrhea, I think. Yeah.
Yes, hello, I'm Dr. Twaiba, emergency physician. May I confirm your name and age, please?
Yeah, I'm David. I am 27.
Hi, David. Are you comfortable right now?
I'm okay.
Okay. Can you tell me what is bothering you today?
Yeah, doctor. The last 2 days, since I back from Thailand, I have diarrhea, and I'm really feel uncomfortable. Yeah.
I'm sorry for that. Can you tell me more about your condition, please?
Yeah, as I said, it started 2 days ago, and it's even I just think like I even didn't arrive here in England. I was on the way. I feel like I don't feel good and I need to go to toilet. Since then I went, yeah. It's just like diarrhea, I would say.
I'm sorry for that. So this area started 2 days ago after you came back from Thailand. Is it right?
Yeah.
Okay. It started suddenly or gradually?
Yeah, I would say suddenly, yeah.
Do you have any other associated symptoms rather than pain? You told me you have abdominal pain, right?
Yeah, I feel uncomfortable in my abdomen here.
Yeah. Do you have any other associated symptoms?
No. Abdominal pain, yeah. I said uncomfortable, yeah. It can be abdominal pain, yeah, I would say.
Yeah. So can you tell me more about the area? Is it watery or it is semi-liquid?
It's like watery.
It has any blood or mucus?
No, I haven't seen any blood.
Okay. Can you tell me how many times did you bath in last 24 hours?
4 times?
Sorry?
4 times?
4 times. Do you have any fever?
Yeah, doctor, first I had the diarrhea, but today I found I have fever. And yeah, I also saw some blood, I would say, yeah. Fever and blood too, yeah.
You have some blood. It's mixed with the stool, right?
Yeah. Today, yesterday, no, any problem. Yeah, just watery diarrhea.
Only one time.
Yeah, the last time I went a few hours ago, I checked it. Yeah.
Sorry for that. Did you vomit?
I feel nausea, but no limits.
Okay. Do you have any feeling like dizziness, shortness of breath?
No.
Weakness?
No.
Okay. You told me you traveled to Thailand. How many days you stayed there?
Yeah, I stayed there 1 week.
1 week. May I know where did you stay, in the hotel or in the room area?
Oh, I stayed in a luxury hotel. It was a nice hotel. I had stayed in a luxury hotel. It was nice. Yeah.
Okay. Did you eat any raw food or you went to swimming in fresh water?
No, I didn't. No, I didn't eat any raw food.
Okay. Sorry.
I just drank a water from the bottle. That's it. Didn't eat nothing.
Okay. Sorry for this question, but did you have any unprotected sex there?
No.
Okay. Is there anybody travel with you who has the same symptoms?
No.
Okay. Before you travel there, did you get any vaccination?
No.
Okay. Do you have any medical history, diagnosed with any medical illness?
No.
Okay. Do you have any past surgical history?
No.
Do you have any previous problem, same problem?
No.
Do you have any drug allergy?
No.
Currently, you are taking any medication?
No.
Okay. Do you smoke?
No.
Do you drink alcohol?
Yes, sometimes socially.
Okay. Sorry for this question. Do you take any illicit drug?
No.
Okay, what do you do for your for living? What's your job?
I am a carpenter.
Okay. So from the information I collect from you, as you have a history of traveling, and you have this area associated with tummy pain and some, and then the last time you pass like bloody diarrhea, most probably you have what you call it traveler diarrhea. I need to will take it to your observation room. I will examine you. I will check your vital signs, and I will run some tests for you, like full blood count, this one inflammatory markers, urea and electrolytes, and stool analysis as well. Is it okay for you?
Okay.
Okay, then after investigation, we'll decide whether to take whether you will be admitted or to be discharged home. Do you have any question for me?
No, thank you.
Thank you. Thank you.
Did you give the fluid?
No.
You have to.
Yeah.
Okay.
Yeah, that's right.
Okay. Another thing is that what do you think what could be the traveler diarrhea? I understand what could be the cause in this patient. You said he just drink water from a bottle. That's it. No any other. He deny everything. What could be the cause, guys?
Dysentery?
Blood. The patient has acute diarrhea.
Coli, basically E. coli.
E. coli.
E. coli cause the bloody diarrhea. Do you think so?
Yes, it makes
No, so Shigella?
Campylobacter?
He deny raw meat or raw food. So Campylobacter less likely. Entamoeba? Entamoeba?
Giardia.
Diarrhea, thick diarrhea, not the watery diarrhea, and no blood in giardia. So it could be entamoeba, histolytica, right? Likely, right? But you need to
in amoeba histolytica, there is less chances of fever. So parasitic infection and the fever is very less likely. What I think.
Okay, no, the fever can be possible. It depends on the infection. Is he is acute diarrhea first, then develops the blood and worsening. Anyway, no problem. So the typhoid can be ruled out because there's no bloody diarrhea, I guess. So what we have to say anyway, we don't need to go for a specific. Is she said is likely based on your information, the most likely problem you're having due to your travel to Thailand. And as you deny this food, so yeah. So what I'm going to do, I'm going to keep you here in the observation room, check your vitals, that you're okay, and I will run some blood tests, which include the stool culture, full blood counts, okay, and I will, if required, I will do tummy scan as well. But I don't think so it's required. So apart from that, I will give you the fluid from your vein, through your vein, okay? And yeah, if once the blood result came up, if I found the specific causative, then I will give you the antibiotic if required further. If not, otherwise I will discharge you with parental leaflet. But in this patient, he has a high temperature, so you need to add the paracetamol as well, okay? And then you can discharge this patient with parental leaflet. Or if you have travel diarrhea patient, but if he said, I just went twice in the toilet in a thick diarrhea, then you don't need to keep in observation even. You need to discharge this patient. But can you please tell me, does this patient need isolation or not?
I think
Yeah, it needs elevation. Yeah. Can you below this area?
Yes. So you need to keep him in isolation room, right? In isolation room, you can give him what else you give medication, what else. So don't need to say the research, but better to say the isolation. Another thing is the treatment, as I said. So you need to mention if the patient is stable, if maybe he's at 2-3 episodes, so you can discharge him with printed leaflet, but you need to give what for hydration?
ORS.
ORS. Yeah.
ORS.
Yeah, you need to give him printed leaflet advice, keep hydrated yourself, frequently eat, okay? And also give him the ORS, the 200 ml or 400 ml after every diarrhea. Clear? So this is how you can deal with the traveler. It's very simple station. You will not have difficulty, but you need to.
Need stool analysis or culture or no need?
What do you say?
Still stool analysis or stool culture or no need in here.
Still culture or still analysis can, if you say analysis, is include everything. That's it. Yeah. Make it simple, right? So you just say culture or still analysis, no problem. Both you can say. In both cases, they will check the OR also in order to extract the organism, which is a cost. Okay, so this you can do, but make sure a few things to be highlighted. Campylobacter called bloody diarrhea. Patient might have the raw meat history or the chicken, poultry breakout. The E. coli usually acute watery diarrhea, anti-amoeba histolytic, cramping, pain abdominal, can blood diarrhea, can have temperature. The typhoid, high temperature, diarrhea, or sometimes constipation. And the prevalence countries or in typhoid, remember that these the location is very important. The region, South Asia, yes, likely to typhoid with high fever. Okay, so you need to rule out. Maybe it's not sure that every time you say maybe likely the problem to your travel, but if you don't specify the problem, maybe you can lose the score. Better try to come to specific. If you're not, then just go simply say it's relevant to your travel history. So, but better to come up to the point and give the treatment accordingly and discharge the patient. Okay.
Yes, thank you.
Okay, so now we see another. Okay, these are the. Okay, Dr. Medina Abbas, right? Anyone to practice apart from them?
Yes, if I'm nobody want to practice, I can go.
Okay.
But I will give chance.
Okay, I don't think so. Other people are maybe better to feel listened today. Maybe next time. Okay, so you just go ahead.
Okay. Okay.
Guys, please stop this the writing on the board, okay, on the screen. I don't know who's this guy. Sorry to say, and I'm not very good at how to remove it. Anyway.
Okay. Hello, I am Dr. Medina. I'm a registrar. May I confirm your name and age, please?
Yeah, I am the James. I'm 38.
Nice to meet you, James. How can I help you today?
Yeah, I have a high temperature, doctor.
High temperature. Oh, sorry for hearing that. Okay. You have. Are you comfortable?
I'm okay. I just took a paracetamol before coming here.
Okay, so sorry for hearing that. I want to just take some information from you. Is it okay?
Okay.
Okay. This fever, is it started gradually or suddenly?
Yeah, it started, I think, suddenly.
Okay, when did exactly started?
Yeah. It started 2 days ago.
2 days ago. Okay. So anything it's making better?
No idea.
Okay. So how bad it is? Fever. It is low grade fever or high grade fever?
I just checked in the morning. It was 38.2.
Okay, sorry for hearing that. Okay. So anything it is increasing your fever?
No idea.
Okay. So any other associated symptoms with your fever?
No. Oh, I just got a little bit headache. Yeah. Not other than that, I'm
yeah.
totally fine.
Okay, so you get a headache also. Okay. So headache, is it unilateral or bilateral?
It's one side just here on my phone.
Only one side. Okay. Okay. So what is your idea, Mr. James?
I don't know what's wrong with me.
Okay. And what is your concern?
Maybe I have meningitis.
Okay. Okay. So I am here just to clear your concern. Let me just asking you more question about your symptoms. Do you have any skin rashes?
No.
Okay. Do you have any neck pain?
No.
Okay. So do you have any throw up?
No. I just feel nausea
Okay.
sometimes.
Okay, nausea only. Okay. So do you just notice any change in your bowel habits?
No.
Okay. Any change in urine color?
No. The
Any
urine, yeah, I think a few years ago I saw something different. Yeah.
when?
It
Sorry,
was
2 days
yeah,
ago?
no, a few hours ago. I went to toilet. Before coming here, I found
Yes.
changes with urine is a little bit dark, I would say.
Mm-hmm. Okay. It is little dark.
Yeah.
Okay. Sorry for hearing that. Okay. Do you notice any blood or only dark?
I think it was dark. I cannot say specifically any blood or anything.
Okay. Do you go before any abnormal movement?
No.
Okay. Do you have any vision problem?
No.
Okay. Any weakness in your body?
No.
Any numbness?
No.
Okay. Do you feeling a loss of appetite?
Yeah, today.
Today, okay. And any weight loss?
No.
Okay. Okay. So do you have any shortness of breath?
No.
So any cough?
No.
Okay. Do you have any chest pain?
No.
Any heart racing?
I feel today, yeah.
Today you feel heart racing. Okay. Do you feel any dizziness?
No. Dizziness, no.
Okay. No. Okay. So with this fever, do you have any tummy pain?
No.
Okay. Okay. So let me just to sum up this something. This is symptoms that you said to me. If I miss anything, please correct me. Okay. Just you said that 2 days ago. Yeah, you started to have a fever. Okay, it is around 38, and also with the fever, you notice also the changing in your urine to dark, okay, and you are nauseated also, and some dizziness is there. I am right?
Yeah, no dizziness. Yeah.
No dizziness. So sorry, heart racing. Sorry. Okay. Okay. And so, do you have any past medical history?
No.
Any surgical history?
No.
Okay. Do you are you taking any regular medication?
No.
Are you allergic from any medicine?
No.
Okay. So, do you smoke?
Sometimes.
Sometimes also only. So do you take alcohol?
Yeah, sure. When I go to the pub, I usually drink. Yeah.
Okay. So okay. So any family any medical condition in your family?
No.
Okay. Do you travel abroad?
Yes, I went to Malaysia.
Mm-hmm. Okay. When this one?
I 1 week ago. I stayed there a week. Yeah.
Only 1 week ago. Okay. So where you stay? In a hostel or in hotel or in hostel?
I went to fishing with my colleague in a countryside.
Okay, so you was swimming there?
No, I just went for fishing and then I stayed there in a camp.
In the camp only, okay. Okay. So Mr. James, according to the data that you give it to me, just I will take you to observation room and I will take your vital sign, and also I will just give you paracetamol for your fever, and I want to just do some urine test, okay? And also I am going also most probably your problem may be you have infection in your urine. But we have to rule out another differential diagnosis. Okay, we have to do Tommy scan. Okay, scan to your tummy. Sorry, and also I have just okay. I cannot just get the diagnosis. I'm so exhausted. Okay, so just I will do all this thing, and I will try just to rule out all the differential diagnosis. And also, you have a fever, and okay. Sorry. This may be this may be also. This could be also this one.
Malaria.
Okay.
Okay. Just sorry, doctor. Okay. So just okay. So we have.
Thank you, Dr. I don't know who
Medina.
is Medina.
Yeah.
Thank you. You tried
Sorry,
best.
doctor. Just
It's okay. So you know that in travel, when we were discussing about traveling diary, I said the most likely here would be the malaria, right? Is it first? Is it, I said I went to
Malaria. Yeah.
yeah, I went to the countryside. I give you history, the clue, Another reason is the dark urine, high fever,
the dark
headache,
urine,
head fever, all good. And traveling, this is irrelevant to travel history. So malaria, okay? Any people, any person go out of the UK, so they should have the malaria. Okay, so this is about, so how you would say, I will keep you in research room, connect to the monitor, check your vitals that you're okay. And I will give you, I will do some, the investigation, include full blood count in malaria parasite investigation. So, okay. Then you will say, I will give you the paracetamol to decrease your body temperature. I will give you the fluid if required in your case. And then if the test confirm, then you need to say, there are several type of the malaria positive agent. If it is the falciparum, I will give you this medication and give you printer leaflet to discharge you. If you have this one, then I will treat you with this medication and discharge you with printer leaflet. But one thing more you need to tell, it's can possible, which malaria cause the alternate intermittent fever? Any idea? Do you know?
Falciparum. Yeah, falciparum. Yeah.
Vivax. I think Vivax is a malaria which causes intermittent fever, means every alternate day. Okay, not every day, every alternate. You need to warn him, the patient, and also give him add one more drug called primaquine, because you need to the dormant stage of parasite to remove or eradicate it from the body. Clear? So you don't need to jump up to directly cerebral malaria, no, because headache is the common in all kind of malaria parasites, okay? Not only in the falciparum, but falciparum, you can have severe. Clear? So, so try to watch the beginning, because you guys are not very familiar with the management plane. Maybe I give you just 10 minutes so you forget, but you need to practice. Write down in the paper what we are talking, especially the management plane, okay? I told you, divide the management plane in following part. Likely problem, differential if required, aid the differential, means just verbalize, then you go for what you will do, examination, go for investigation, go for treatment, go for advice. These are the steps in the management plan. If you don't follow that, your management plan is just like, I cannot correct you. That means the examiner will be exhausted to see that what she or he is talking. So you need to be very careful, concise, follow it, okay, step by step, not jump up here or there. And the systemic review, for example, you ask the travel history before management plan. You're supposed to ask this travel history after systemic review, then past medical history, then etc. Because relevant always should priority. Clear?
Yes, sir.
Okay, so do you have any question, guys? I think this was the last station so far. I hope.
Here, Dr. B, we need to isolate the patient, right? And notify authorities in malaria, or?
Yes, I think malaria is with the mosquito bite, right? In the hospital, I don't think so. Need isolation. I don't think so. Mosquito can come up to the hospital. Do you think so?
No, in the country now we are living here. They are isolated the patient.
Yeah, if
here
you want to
isolated disease.
Yeah, if you want to isolate.
Isolated and notifiable.
Oh yeah, one more thing. You need to notify the England Health Department. Yeah. Notifiable, because the malaria is a notifiable disease. I forget to mention that. Yeah, malaria is a notifiable disease, so you need to mention it. Yes, you can keep in isolation too, because these things you need to put in the advice, like you need to use the mosquito net for a couple of days, etc. But it's very hard to find mosquito. But if you find in the UK mosquito, they are really big.
Okay, really Dr. B, even in the patient with bloody infectious bloody diarrhea, it's also notifiable disease. Yeah.
There are a few. I think these are many diseases are non-notifiable. I think so. Epstein-Barr virus. The another. I think this is non-notifiable. HIV disease is not. HIV infection is non-notifiable.
The infectious pleuropneumonia is one of the notifiable diseases.
I think maybe I'm not sure. Need to check it out.
I'm sure about that.
I have one question,
Doctor,
sir.
the travel history
Regarding
One by one, please. Yeah, talk.
okay, regarding the vaginal bleeding in menopausal patient, I have to ask the patient when she started the time of menopausal in the history wise.
When she started what?
I have to ask her when did the menopause time started for her?
Yeah, yes. When did it started? When was your last menstrual period? Because this can give you a clue.
Okay.
Because the postmenopause is a self-definition greater than 12-month new period, but less than 12 months it can be another problem. Yeah, make sure. But in the exam, they mention already on the postmenopause. Okay. Another. Someone was asking question. Yeah.
Yes, the travel history, it will be after analyze the symptoms direct or after past medical history and family history.
There are two ways to ask the travel history. Either after you go for presenting complaint, go for directly to the history of the travel history. Another way, you go for all the systemic review, then come up to travel history. You have both choices. Yeah. But you need to cover this travel history must be. Another?
Yeah, okay. Thank you.
Okay, thank you for
you. Thank you so much.
I think thank you very much for coming.
Thank you, sir.
You guys need to work.
Doctor, do you have another session? 3 session,
yes.
I mean.
This it will be continued till the November if I have time. All will be free until you pass your exam.
Thank you so much.
I'm not
so
sure.
much. Thank you, Doctor.
I
We are
appreciate,
appreciating.
really, we appreciate. Thank you a lot.
I cannot promise about how long, but as long I have time, I will go ahead till your exam.
You
till
will
November.
announce in the group.
Yes, I will announce how long I will. I will announce the next webinar date. Of course, I will give you also the next webinar. Don't worry about it. Next webinar will be on the pediatric, I think, and the one more webinar should be on the Adipara relevant, but not really. It is about the event, life-threatening event. So we will come up to this one next webinar. Then APL is. Once we come up to LS on the ATLS, and this we will go very, very fast because I will simplify it for you. Just need to follow. These histories are a little bit complicated because it's very long. Need to write down, need to mention each and everything, and this really consume a lot of time for me. But anyway, we already get rid of it soon. So the last webinar will be next week. Thank you for coming, guys, and good day.
Thank you, sir,
for your time.
Thank you, Doctor.
Yeah, you're welcome, guys. You're welcome.